Health experts are also monitoring the number of COVID-19 patients who are in hospitals across the state of Maryland. Keith Daniels joins us live right now with more on why that indicator is a critical one to watch out for. Keith?
Okay, health officials say they don't want to find themselves in a situation where the hospitals are not able to keep up with demand. But tonight they say, so far, the condition is stable. In Maryland, coping with COVID, the number of coronavirus cases shooting up. The state added more than 3,700 new cases of COVID-19 today, way more than any other day since the outbreak broke out. With more cases expected to come, state health officials are keeping watch. Dr. Ted Delbridge.
Well, the concern obviously is that hospitals have become super saturated.
Is with Maryland Institute for Emergency Medical Services Systems. He monitors the numbers of patients needing services on a statewide level.
Although there's been an increase in the number of COVID-19 patients in the hospital, the availability of beds in hospitals has remained steady over the course of the last couple of weeks.
Delbridge says there are almost 1,300 COVID-19 beds available now in Maryland, with about 1,600 COVID patients in hospitals now across the state. Trish Johnson.
I'm just really still in shock.
Knows how critical those beds can be. Her father is Charles Johnson, the longtime Department of Public Works employee who died from the coronavirus this week. Johnson spent 3 weeks in the hospital. It all started with a fever that would not go away.
There was no coughing. There was no, he said he hadn't lost his sense of smell or anything. And we were just concerned with the fever. And then 6 days later, his breathing started to become labored.
Well, Mr. Johnson was 73 years old. Meantime, with cases on the rise, health experts say they worry about those who do have the coronavirus rather, and do not, or rather have not been tested. They say those cases could in fact affect the total number of cases.
Longtime city employee is dead after testing positive for COVID-19 in early November. Charles Johnson worked for the Department of Public Works for 45 years. Keith Daniels reports on how DPW is under scrutiny over the safety of employees.
Well, co-workers say Mr. Charles Johnson was a man in his 70s, but had the energy of a man in his 30s. Tonight, his death and a closer look at workplace safety. Tonight, somber news at the Baltimore Department of Public Works. Charles Johnson, a longtime employee and supervisor at the Patapsco Wastewater Treatment Plant, is dead, a victim of COVID-19. His death,
We offer our sincere condolences to the family.
Triggering more concerns over the safety of DPW employees during this coronavirus pandemic.
We are following the CDC guidelines. We are keeping our employees safe.
But City Councilman Zeke Cohen,
they are on the front lines of this pandemic,
believes DPW can do more to help keep employees safe from the virus, particularly regarding personal protective equipment.
and in terms of personal protective equipment, it is not a maybe, but a must. It is simply a tragedy that this man lost his life to this virus.
We're doing everything that we can do to keep our employees safe.
Is it enough?
Well, I don't know if there will ever be enough. This pandemic is unlike any pandemic that we have experienced. I have experienced in my lifetime.
DPW workers have been among the most vocal city employees with concerns about their safety and COVID-19 over the past several months. At one time, sanitation workers triggered a slowdown near stoppage of garbage collection, and curbside service for recyclables now temporarily shut down. And tonight, the biggest blow, the death of a worker.
This is an incredibly tragic situation.
Well, DPW says in addition to providing employees with PPE, they also give them uniforms, especially sanitation workers. They can keep those uniforms at the job. They have a laundry service there that's an added form of protection, so they don't have to take those uniforms home.
University of Maryland medical system shows 65% of people in the state say they plan to get the vaccine when it's available. But some people, especially in the Black community, are hesitant about getting this vaccine, and their reasoning dates back to the 1930s.
I don't see any need for me to get it.
Some people in Baltimore are not planning on getting the COVID-19 vaccine.
No, because I don't know what is in it. I take my chances on eating oranges.
While others are fully on board.
It seems like it's going to be something that everybody has to do. So, I mean, if it'll help everything open up faster, why not get it done?
However, she was able to recuperate.
In the Bel Air Edison neighborhood, Rita Cruz leads the community association. She says some of her neighbors are hesitant.
The ones who are skeptical are thinking about the time when a lot of blacks were experimented on in Tuskegee.
The Tuskegee study, done on primarily black sharecroppers in Alabama to learn the impacts of untreated syphilis. The participants did not know it was being done.
Some of them are young people. It has been passed on from generation to generation. So that's why you do have a lot of people who are skeptical. And then many people just don't trust the government. They don't trust the government. They really don't.
Cruz says the more information and transparency put out there, the more people will start to rebuild trust, which she says could mean the difference between life and death for people.
If they can a little bit about things that have happened in the past to blacks like Tuskegee and other experiments and decide, I want to live, and as a result of that, they get this vaccine.
From a vaccine standpoint,
Governor Larry Hogan's COVID-19 advisor, Dr. David Marcosi, says he understands how the expedited vaccine process has caused some concerns.
I think the federal government removed a lot of the unnecessary bureaucracy, but it left in the mandate around developing a safe and effective vaccine.
COVID-19 is disproportionately killing Black Americans, and in Baltimore,
it's surging every single day.
Cruz out with a frank message.
No longer having any legacies because you won't have anybody to pass anything to if you're not alive.
Now, Rita says she understands where people are coming from if they're hesitant about getting this vaccine, but she says if Dr. Fauci says it's safe, which he does, she'll get the vaccine.
Good evening, I'm Rielle Creighton. The post-Thanksgiving surge from the coronavirus continues its relentless upward trend. For a second straight day, the state health department reports a day of over 3,000 new cases. Today, that number was nearly 3,200, ranking second in the pandemic only to yesterday. The number of hospitalizations creeps ever closer to 1,600, up by 4 since yesterday. The state's positivity rate is now at 8.04. That is the highest it's been since June 4th. And 29 more Marylanders have died from the virus since yesterday. Well, this week, COVID-19 has caused more deaths than heart disease, lung cancer, or stroke. That's according to the Institute for Health Metrics and Evaluation. 14,000 deaths have been reported since Thanksgiving. As numbers broke records around the country this week, Johns Hopkins reports that over 51,000 cases and 655 deaths on Friday alone. And experts warn the worst is coming. New hope is on the horizon with pharmaceutical companies working to obtain FDA approval and states making vaccine distribution plans. But experts caution this will be a difficult and deadly winter. Well, as those numbers continue to climb higher than the peaks that we saw at the beginning of the pandemic, questions tonight on if we need to roll back restrictions even further to slow that spread. Fox 45's Dan Lamparello has one county executive's concerns and what medical experts are saying.
Hospitalizations here in Maryland are reaching highs that we haven't seen since the summer. And with a record number of positive cases being seen almost daily, some local leaders say more action needs to be taken now.
For the second straight day, Maryland recorded more than 3,000 new cases of COVID-19.
Really, I think a worrisome trend.
Dr. Jennifer Nuzzo is an epidemiologist with Johns Hopkins University and says if we don't get a hold of this outbreak now, darker days are definitely ahead.
The need to do that now is greater. As the amount of infection that's occurring in the community increases, the probability that you'll run into somebody who is infected with COVID has increased. And so now is the time to be extra cautious.
But while everyone agrees we need to be more vigilant, not everyone is on the same page about the next steps to take.
So I continue to believe that further restrictions on contact between individuals are called for to protect our healthcare system.
Anne Arundel County Executive Stuart Pittman says he wants to see restrictions rolled back even further, possibly stopping indoor dining. But he wants other local leaders to follow suit before taking any action.
Enough counties to act together so that it would work. If Anne Arundel County goes alone, I fear that folks will just congregate in other locations, or that it won't work as well.
Governor Hogan lifted Maryland's stay-at-home order nearly 7 months ago. At the time, there were nearly 1,500 COVID hospitalizations, a number we've seen once again creep up over the past few days.
We're undoubtedly not far from the place where care is rationed, where there's not enough care for everybody.
But Governor Hogan said this week he has no plans right now to impose any more restrictions.
We've taken some pretty aggressive, probably the most aggressive actions of any state in the country, and we'll take them as we see fit, as we have been for the past 9 months.
Governor Hogan has always said that local leaders can roll back restrictions as they see fit. But what's unclear tonight is if or when they may do so.